There she is. Hi,
Hi.
Jenny. Hey, Jenny, can you make your face big for a minute? Oh, wait.
He is.
There we go. That's better. That's okay. And then are we recording?
We are. Yes, we are.
Okay, awesome. Well, I'll start out. I want to introduce you all to one of my rehabilitation services students. This is Jenny Nicastro. Jenny is a licensed occupational therapy assistant in Arizona, and she's going to teach us about some of the work that she's been doing with EEG, and she'll kind of orient you to what the therapy is and how it works. And we have a live demonstration as well, correct?
We do. Katie's already hooked up.
Oh, good old Katie. So I'm going to go ahead and turn the time over to Jenny, and she's going to leave us some time for questions. Go.
Good morning. EEG Neurofeedback is something we use in our pediatric clinic. We also use it for adults and for families too. Neurofeedback is a non-invasive and non-drug related approach to training the brain. So basically it's just holding up a mirror to the brain through the EEG, and the biofeedback demonstrates where the brain is, what waves it's demonstrating at the time. Through normal daily life, we have different responses, stress responses, activity in the brain that kind of gets us stuck in the way that we behave and respond. And EEG neurofeedback actually holds up a mirror to the brain to show that it's not at its optimal functioning level. So kind of like slouchers, we're used to slouching and bent over, especially with our day-to-day work on computers and telephones, with our cell phones. But when you tell yourself to correct yourself, you sit up straight. And that's basically what EEG does. The neurofeedback does is we train the brain to actually fix itself. On our end, as the clinicians, we don't do any type of manipulation to it. We don't up-train or down-train at all. We basically let the program work its magic by itself. So the brain decides to determine if it likes the way it feels or if it doesn't, and then how to correct itself. There is music that is played. My daughter, Katie, she's 14. She's currently hooked up, and the training is in session right now. I'll show you what it looks like. But through the music that you listen to, it's a very soft, soothing music. And as the brain decides to deviate from its happy place, basically, it causes a slight interruption in the music. Nothing obnoxious. It's just like a small static. And I'm hoping you'll be able to hear what that static sounds like. Because then what happens is the brain decides it doesn't like that music or that static, and it changes itself to get the music back to its fluid state. So this information actually carries on with you throughout the day. Whenever your brain starts to deviate, then it remembers that training, and it starts to be able to help itself heal, basically, and teaches its resiliency. This has been an amazing program. I actually hooked myself up for this just to help with stress. Full-time work, 2 classes, 3 kids. I'm a grandma. My husband is doing his master's program. So when I have kids that cancel, I will hook myself up just to kind of give my brain that rest that it needs. But this has been used all over for issues such as PTSD, autism, anxiety, chronic pain, and there's so many different ways that we've seen it being useful. We have nonverbal children that we work with, and one of the 16 targets that it hits, it demonstrates pain. And we were able to find on a child who was nonverbal that they were in chronic pain. The mother started doing discovery and found out that the child had a Chiari malformation, just had surgery, and her pain has been reduced significantly. Also with epilepsy, we have some children with epilepsy. We don't treat it, but we actually help the brain to kind of slow down its pace so that those neurons aren't firing as fast as they would. We've had some children who've actually had a significant decrease in seizures because of using this program. So I'll show you what it looks like. I'll show you my daughter, Katie, and hopefully you can kind of see the colors. And I'll play the music through a speaker, and hopefully you could hear the little bits of static. Since she's very anxious, this actually works for us because you'll get to hear the static. And you'll get to see how the brain recorrects to get that feedback of the music back to where it's in its normal, where it's supposed to be. Okay. Take a deep breath. Are you on? Okay, say hi. Hi.
Katie.
Take a deep breath. So down here, these dark colors, I don't know if you could see them or not, that actually shows discomfort. And notice when Dr. J first said hi, her color went out. Because she realized that she was on the camera.
Oh gosh, I just.
So down here, this shows the left side of the brain and the right side of the brain. Down here, these are more the subconscious thinking. This is like where our limbic system stores information that we're not conscious of. The higher up it goes more to the executive functioning part of the brain. So we actually use this system while we're working with kids. We actually work on things like fine motor skills, executive functioning skills, social skills, multiple things. And you could tell when they start to get stressed, especially right here, this is the anxiety, the light blue. As that starts to go out, the brain starts to self-correct. Here's a sample of the music. Let me know if you can hear it okay.
It's has a lot of bass. There we go. That's good.
So now here at the bottom, that's where the discomfort is and the pain, a little bit of anxiety. Executive functioning, we're not accessing too much right now because she's not engaged in an activity that would cause her to work on planning skills and organization. But one of Katie's things that she doesn't like to do are puzzles. Visual perceptual is difficult for her. So her therapist will have her work on puzzles intentionally, and you'll see those colors go out along with the anxiety, along with frustration, to help her work with those, because those are skills she's going to need to help her with reading, organizing her folder in school, and this is how we're able to bill for it through occupational therapies, because while they're doing this, we're actually involved in therapeutic activities at the same time. Does anybody have any questions about the program? Or you could even ask Katie directly to see how it feels or what she thinks about it.
Does anybody have any questions about it? You guys already know everything there is to know about it.
Where does it connect? How does it connect to?
How does it connect?
So there are 4 electrodes and 1 base. And there are these 2 electrodes that are placed on the C3 and C4 region of the scalp. And then she also has 2 electrodes on top of each ear. And then we have the grounding wire, which is on the earlobe itself, just like you would in a regular EEG. A typical EEG would have several more placed on the scalp, but we're just getting the information from the sensory cortex of the brain to find out where those brain waves are right now.
Any other questions?
What does EEG stand for?
What does EEG stand for?
Oh, geez. Electrical. I might have to.
Electro.
I don't remember. I've said it so many times I've forgotten it.
I got you. I got your back.
I have a question.
Yes.
When someone has several treatments, is this effect permanent or do the returns diminish over time?
So the question was when someone has, this microphone isn't working. Well, let me try this microphone again. Hold on, Jenny. That's a good question. Okay. Can you hear, Jenny?
Yes, I can.
Nope.
I can hear.
Hold on. Jenny, can you hear me?
Yes, I can.
Ask your question.
When someone has several of these treatments, are the effects long-lasting or do they diminish over time?
Eventually they do diminish over time, especially if there's new stressors and things that happen in life, new traumas, death in the family, things like that. Eventually the brain starts to go back out to its deviation that it was before you started, but it's not something immediate. Your brain does remember the training. It just may not be as powerful as it once was when you first started with the training.
Yeah, so the brain is like any other bodily function, right? The body tends to want to return to a homeostatic state, right? And so it wants to try to balance, and sometimes that balance is dysfunctional. And so the brain, are you guys familiar with the FIT principle? Frequency, intensity, type, and time, right? And if you're doing a certain activity to change your body or brain functioning, unless you adjust one of those, then no matter what you do, you will return to your previous state, right? So let's say that you're trying to lose weight and you decide that you're going to go running for 30 minutes every day. You go out, you go running, right? 30 minutes every day, you run the same route every day. At first, you'll start to notice the physiological change, right? But eventually you'll plateau unless you change the frequency, the intensity, the type, or the time. Then eventually you're going to regress back to your previous state, because even though you're continuing in that activity, your body will kind of continue to, in its previous state. And so the brain is similar. How'd I do, Jenny?
That's awesome.
I want Katie to tell me if she can tell the effects that are happening during a treatment. What does she feel during the treatment?
I feel very tired during it. It calms your brain because I'm very, very awake during the day and stuff. And then when I get to neuro, I feel very calm and I feel like taking a 5-hour nap. I don't know what else I feel. I feel really calm and stuff, or especially stuff I don't like.
Yes.
Then I feel very tense.
That's a great answer. Thank you.
Mm-hmm.
Yeah, Jenny was telling me the other day, I thought this was interesting, that when Katie does this, when she gets done, she actually has to go home and take a nap before she goes back to school or whatever.
I try to, but it doesn't really happen because then I get so much anxiety that I'm not doing my homework.
Katie struggles with generalized anxiety, and which on top of puberty too doesn't help. So she does take a mild medication to help her with her anxiety, but we use this primarily to help her with social situations and just getting through stressors of daily life, being 14 and a girl. But she's done so well that she's actually been reduced down to 1 time a week and has done really, really well with it. It's helped her sleep. How else would you say it's helped?
I used to have a mouth retainer at night,
Mhm.
because I would clench my teeth really hard at night, so I'd get headaches in the morning. But after like a month or 2 months, I think, I don't remember, but I didn't have to use it anymore. So I don't use enough pain anymore.
Mhm.
That's cool.
What else? I don't know anything else.
Has your sleep gotten better?
Not really. I still wake up during the night.
How about attention? Like paying attention?
Well, I'm really good at paying attention.
I can say from mom's point of view, from my point of view, that her attention has gotten better and she doesn't fall apart as easily if something doesn't go right for her. Katie tends to be very perfectionistic, and if something doesn't go exactly the way that she thought it was or how she planned, she's a little more flexible with her thinking. So she's able to move forward instead of being stuck in that moment and fall apart into emotions, which is pretty exciting for, you know, a teenage girl.
That's awesome. We have another question.
Sure.
If I ask from right here. Can she hear?
What was the question?
Oh, so I have a cousin who has seizures and she's not epileptic, but she gets anxiety-induced seizures. Do you think a treatment like this, would you recommend this type of treatment, and how do you think it would help?
Oh my gosh, absolutely. We have kids with epilepsy and then non-epileptic seizures. And those anxieties especially are huge in prompting those. Also temperature, since this actually goes toward the base of the brain and the limbic system, it actually helps you regulate temperature appropriately, which can help reduce those seizures. So this is not a treatment. We can't call it a treatment. We're not able to diagnose and say that we can treat things, but it trains the brain. So by relaxing the brain and getting it out of that dysregulated state, teaching it to stay in its happy place, that's how we're able to get the brain to be able to slow down and not produce as many seizures, by calming the anxiety, calming the emotions, and then temperature regulation too.
Awesome, thanks. And how would she be referred to this type of, I guess, program, or where, or?
You can find providers by Googling it. The particular program that we use is NeuroOptimal through Zengar. And the reason why we chose this one over others is because as trainers, we're not the ones that change the system in any way. We don't try to manipulate them through producing different brain waves, because the brain may not be able to tolerate that. It's very subjective when you look at them and say, well, I really want you to be more in a beta wave. I want your beta wave to be stronger and your delta wave to be more subdued. We shouldn't do that. So this particular system on Zengar.com, I believe, they will tell you, their trainers, whoever has their system. You can even buy this at home and use it at home. It's about $5,000 for a home program. And my boss, through our company here, she has 5 machines and she does the business pack, and it's about $10,000.
It's a good deal. 5 machines.
Awesome, thank you so much.
Sure.
I have another question. How long does a treatment session last?
An hour.
It's about an hour, 50 minutes. And during that time, you do the pre-baseline and the post-baseline before and after they start, to kind of see how they responded during the treatment. It gives you numbers, and the numbers really aren't necessarily important to the person or to us. It just kind of gives us an idea of how they're responding. Every day is different though. So Katie, I started her baseline before this and started at about 998, which is low. Under 1,000 is pretty good. I've started with kiddos who've started at 25,000 because of increased anxiety. I know for myself, I've been as high as 16,000 depending on the day. And we're hoping that by the end of that session, after about 45 minutes of training, we're hoping that deviation is about in half. We're hoping that we can cut that number in half. If it doesn't happen, that's okay, because the information is still being integrated throughout the brain during that session, throughout the day and the week.
Awesome. Yes.
You talked about chronic pain kind of briefly. Have you worked with any other patients that you figured out did have chronic pain, but no one knew due to like this treatment? Actually,
I have chronic pain. I have a really bizarre brain condition that gives me chronic pain. I produce too much cerebral spinal fluid. And instead of getting a shunt, I tried medication to try to reduce some of that pressure on my head. And I was getting migraines. I would have some CVAs. I would have left side CVAs. And it was because of all the excess pressure on my brain. It's called pseudotumor cerebri. And I started doing this to try to help. And I've been able to avoid getting a shunt. I have times where my headaches are increased, but I think they're more stress related and hormonally related. But after doing this, it actually helps. We have a woman here too, one of our other therapists who has chronic migraines, and she will hook herself up to try to help get rid of that chronic migraine. We have a person who comes in with fibromyalgia, and it actually helps with them tremendously. Those flare-ups aren't nearly as intense. It hasn't gotten rid of it completely, but since those flare-ups aren't as intense, they can function a lot better.
Thank you.
Sure.
Any questions? You want to show us your slides?
Sure. So because it's drug-free and it's non-invasive, that actually is great, because when you have kids come in and we have these sensors, it can be very terrifying to a small child, even to adults sometimes who have never had to go through anything like this. It rests on the scalp and on the ears. We have a conductive paste that we use that it just rests, and there's no needles or anything. Whenever there's that dysregulation during that time, that's when you get that pause or that interruption in the music, so that the brain self-regulates itself to get that feedback of the music in a positive way. And there's a ton of research. We have a huge book here filled with research, but I only picked a couple things. It's FDA approved for stress reduction, which is pretty awesome. And then the American Psychological Association, they actually host workshops to show the efficacy of this to treat issues like TBI, Alzheimer's, Parkinson's, and other types of treatment-resistant psychiatric conditions. And then the applied psychophysiology and biofeedback, they have 5 levels, one being not really efficacious. And then they have the 5th level, which is they've seen high results of it. Level 3 or higher for their testing that they've done with this has actually showed higher efficacy in things such as addiction, ADHD, chronic pain, and epilepsy. And the clinic that I work at is called Kid Abilities. We see so many children, reactive attachment disorder, oppositional defiant disorder, fetal alcohol syndrome. And during the time that they're hooked up, that's when we get to work on other things to help promote those skills that they need, fine motor, social, and executive functioning skills. We actually hook up parents and caregivers too. We definitely take a family approach. And some family members, especially as moms, I have a special needs son. He's 16 with autism, and it's common for us to kind of cycle with our children whenever they have special needs. We're always on edge, wondering when the next shoe's going to drop. And between all the appointments and schooling and doctor's office visits and stuff, it gets very stressful. And so we hook up the parents and the caregivers to try to help give them that support that they need to. So that way it helps that stress reduction and that stress response at home. And then we also have adults in our community that come in after hours. We have 150 drug and alcohol rehabs here at the hospital, or in our area. At our hospital, the majority of our patients that come in are usually from withdrawals or overdoses. And I work there, PRN, and a lot of the adults that we have that come in are struggling. And so this has actually been able to help train the brain for issues such as addiction too. The service learning project that I'm doing, I'm working with a beautiful family here in our community. I've been working with a preteen boy with autism and doing neurofeedback with him. his grandfather just passed away with ALS. And the mother, I've decided to hook up for free, and also her mother, the one that lost her husband of 52 years. Both of them, the mother herself, just raising a child with autism, and then being the matriarch of the family, other than the mom, trying to keep the family together. It's been very stressful for her, so I've been able to hook her up while her son is with me. And then also her mother, who is dealing with loss and has horrible insomnia. Just yesterday, I spoke with the family, and the grandmother is sleeping a normal 6 hours a night, which is a huge improvement for her. And then also, she's now visiting family. She is coming out of her grieving stage. It's been about 55 days. She's coming out of that grieving period right now and is visiting family, staying with other siblings, or not siblings, with her own children to visit with them. And the mother said that her stress response has gotten better. When they had their 40-day memorial service, part of their tradition is that 40 days of death, the family gets together and has a meal. She said that she was able to handle some of her annoying siblings that are very contentious. She was able to handle them a lot better than before the death of her dad. And that's it.
Does anybody have any questions about that? Any other questions for Jenny about the work that she's doing? Okay, that was awesome.
That was awesome. Thank you.
Yeah, and if you guys have any questions afterwards or later, you can just contact me. You can email me, and I can forward that onto Jenny. Or I guess if you're in our Families and Rehab Services class, and you can email her yourself. But my email is, I'll give you the program email. It's rehab@wnmu.edu, and that comes to me because I am rehab@wnmu.edu. So thank you again, Jenny. That was amazing. And
Thanks.
You've also set a precedent for how good online presentations can be. So thank you very much for commenting with Dr. Jenkins on this.
okay.
Well, that's also, my husband is the IT guy, so he took time out of work to help me. So I'm not
Tony.
a techie person. Yeah, so thank you, Tony.
Tony, it was awesome.
Thank you.
Thank you.
Okay.
Have a good day.